Well, 17 MPs raised concerns about the novel coronavirus following ministerial statements on the government's response to the global health emergency. Well, their questions ranged from why Singaporeans in Wuhan with symptoms of the coronavirus weren't able to be brought home, to whether employees can be certified free of the illness.
I'd like to pose a question to the Minister for Health. What will his comment be for those employees who seek certification on being free from the novel coronavirus in order to go back to work?
Actually, there's no such thing as a certification for coronavirus free. The reason is because we test the patient based on his viral load, and there is an incubation period during which the patient may have very low or zero viral load, but at the same time, because it's incubation period, the virus may emerge later on. So it is not possible for a hospital or for any screening center to give a certificate that this person is virus free. I will also take this opportunity to encourage or to explain to employers, to urge employers not to send their workers to our hospitals for testing in order to certify their workers and virus free. As I explained, first, it is not possible for the certification to be issued, and secondly, you are just simply loading our hospitals unnecessarily.
In regards to the method of distribution of masks, I'd like to ask the government to share its considerations behind why the masks were not mailed out rather than collection being made at different collection points.
If you were to distribute masks via post, there may well be wastage because some households will not need the mask. And they, like I mentioned earlier, even in the collection exercise, when we go around and residents come to us, they say, actually, please, I don't need the mask, I'm not going to collect it. You save it either for your stockpile or you give it to someone else. So in that sense, a collection exercise would be a more prudent way of distributing masks. And to address the concern of people gathering together, we have decentralized the distribution points. To void decks, RC centers, it is proceeding in a very orderly fashion. So there are no large crowds at all in any of them. Right? People are just picking up as and when they are free during the designated times. So actually, based on the exercise that we have done so far, I would say this distribution method is more effective.
You know, when we heard that the 92 Singaporeans are brought back from Singapore, I mean, we're very happy to hear that. Also sad to hear that the fourth of them had symptoms, therefore can't be brought back. I was just wondering what kind of medical help would they receive in Wuhan if we stay them there. I mean, the plane capacity is big enough. Could we have brought the 4 of them back as well in the first place to receive treatment over here, even if they have symptoms, if the symptoms are not that severe?
And we all know from a medical point of view, in the context of an epidemic, and particularly when you're dealing with a global or potentially global epidemic, it is most unwise to put people on commercial aircraft when they are febrile and potentially actively shedding virus. So there was good medical rationale, and that's why the Chinese authorities made, in my opinion, the right decision that these persons should not fly. If they did, it would have been contravening not only their own regulations but also WHO recommendations. It's not just China's problem. This is a common threat confronting all of us. This virus does not respect passports or nationalities, race or language, and that's why we must all cooperate and collaborate and to resolve this problem together. So I commit that we will continue to work closely with the Chinese authorities, and any way in which we can help them is also helping all of us collectively. So rest assured, all the Singaporeans are overseas, MFA, we will not leave anyone behind. We will look out for you.